सर्वदा वक्रतुण्ड महाकाय सूर्यकोटि समप्रभा निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा
Am I audible? Good afternoon to everyone who have joined here. On behalf of the management, principal, and vice principal of Shri Krishnaswamy College for Women, I welcome all the teaching fraternity from various schools and colleges to today's FDP jointly organized by Shri Krishnaswamy College for Women, Shift 2 and SIMS. We are highly honored and privileged to collaborate with SIMS for this FDP. The prime aim of this 5 days FDP is mental and emotional well-being of teachers who are the pillars of building tomorrow's society. We are gathered here to explore critical insights into the webinar on preserving vocal cords for teachers. And we have with us Ms. Nayanthara Nambiar, speech pathologist. Today, we are incredibly fortunate to be joined by a dedicated expert in the field of speech language pathology, Ms. Nayanthara Nambiar. Ms. Nayanthara is highly accomplished speech pathologist currently based in Chennai. Her career is defined by a deep commitment to empowering diverse populations who navigate the complexities of communication and swallowing difficulties. That is, she currently serves as a speech pathologist at SIMS Hospital, SRM Institute of Medical Science. Her background is extensive, having worked as a consultant speech language pathologist with AVAC Incorporation, where she has focused on teletherapy and augmentative and alternative communication. From providing neurogenic communication disorder assessment at Unified Brain Healthcare to working within the Department of Education in South Australia, her experiences spans multiple continents and clinical settings. She holds a master's degree in speech pathology from Flinders University and a bachelor's degree from Sri Ramachandra Institute of Higher Education and Research. Ms. Nayanthara's expertise is further highly highlighted by a certification in fibro-optic endoscopic evaluation of swallowing and specialized programs like Speak Out. She has also been recognized with prestigious honors, including the Staff Prize for the Master of Speech Pathology. Beyond her clinical roles, she has contributed to the field as an academic tutor and a student ambassador, sharing her knowledge and supporting the next generation of professionals. Please join me in giving a warm welcome to Ms. Nayanthara Nambiar. We look forward to the invaluable insights she will share us with us today. Ms. Nayanthara ma'am, the floor is yours.
Hello. Okay. Everybody is saying good afternoon. You're all able to hear me okay? If someone can respond on the chat, or if Dr. Shivashankari, if you're there, you can also respond. Hi. Okay, they said yes. Okay, they're able to hear. Okay. Thanks for clarifying. Okay. Good evening, everyone. My name is Nayantara, and like as Dr. Shivashankari was saying, I'm a speech pathologist. So today I hope to talk to you about voice health and what are the things that we can do to take care of our voice. So I'll just share my slides and then we'll get started. All right. So I thought first we'll start off with what exactly voice production is, like how are we making the sound or how are we making our voice. So essentially it fits into 3 steps, right? So நம்ம குரல் எப்படி வெளில வருதுன்ட்டு யோசிச்சா, then there is from the lungs, we are pushing out the air. So that is the airflow. Then it comes to the throat. Tondaila we have the kural valai or the kural nangal, the vocal cords, which then move to produce the voice. And then from there further on, when we open our mouth and move our tongue and all of the muscles, you have the voice that comes out, right? So there's these 3 steps need to happen for voice to be heard and spoken, for words to be spoken outside. Now, if we look at this throat part, right, when we talk about the throat, we're thinking about the structure called the larynx, or if we simply call it the voice box from where the voice is produced. So I just thought I'll show you that a little bit in more detail. So this is the vocal cords, or in Tamil we call it the kural nangal. There's 2 of them. அது ரெண்டுமே அசைச்சாதான் குரல் வெளில வரும், right? So they both need to move. Here you can see the closed position and here the open position. So essentially it needs to have like a wave like motion, open close, and that's how when we say we're able to produce that voice. So essentially this is how the voice is produced, and inside our throat this is what the structures look like. Now, I'll just show you a very simple video of when I said that open and close, this is what it looks like. We've gone into the throat with the camera and we're seeing how it moves. So, அந்த குரல் நான்களோட அசைவுகள் உள்ள போய் கரெக்டா அது பார்க்கறச்சே, அது நடக்கறச்சே நாங்க பார்க்க போறோம். Right? So when it does that big open, when it opens like this, then that is when they're taking a deep breath like that. And then when we start saying or e, that's how the movement is seen. So it's almost like a wave, and these 2 white V-shaped structures are the vocal cords, right? So we'll watch it again. Okay, so this is the normal vocal cord movement that we should see, and this is the normal voice that we should be able to hear. And as you can see, the sutti vocal cords sutti irukra structures ellame kuda romba healthy ah irukku, romba moist ah irukku surface ellame. So this is a really good voice and a good voice production. Now, when the voice is not so good, what can that look like, right? So now we will look at abnormal voice production. Like sometimes அந்த vocal cords அந்த குரல் நாண்கள்ல either some அடிபட்டிருக்கோ இல்ல அதுல there's some boils or blisters. We have different technical names for it, but essentially if there are any changes to the vocal cords, then அது வாய்ஸ் குரலை மாறறதுக்கு நிறைய வாய்ப்பு இருக்கு. தென் ஒரு வாய்ஸ்ல ஒரு கரகரப்பு வரலாம், இல்லைன்னா நீங்க லவுட்னஸ் நீங்க வாய்ஸை ரேஸ் பண்ணி பேசும்போது அது கஷ்டமா இருக்கலாம். ஸோ ஃபர்ஸ்ட் we will look at what that can look like.
When a vocal cord injury is suspected.
So இங்க பாத்தீங்கன்னா there is some injury to the vocal folds here, right? So அதை தாண்டி அவங்க ஸ்டில் அப்படின்ட்டு வாய்ஸ் பண்றாங்க. ஸோ அந்த டைம்ல வாய்ஸ்ல இருக்கிற சேஞ்சஸ். Again, I don't know if you heard that, but திருப்பி அது கேட்கணும்னா நீங்க ஜஸ்ட் அந்த பிரேக்குக்கு கவனிக்கணும். ஸோ அவங்க சொல்றாங்க, நடுவுல பிரேக் ஆகுது, அந்த மாதிரி. So that's the change that happens to the voice. இப்போ நீங்க பார்க்கலாம், லைக் அவங்க அப்படின்ட்டு ஸ்ட்ரெச் பண்ண ட்ரை பண்றாங்க, ஆனா நடுவுல இட் இஸ் கெட்டிங் ஸ்டக். அவங்களால அந்த சவுண்டை இழுக்கவே முடியல. ஸோ they're not able to stretch out that sound, and towards the end it's sort of almost breaking. Voice வர மாட்டேங்குது. There's no voice that's coming out. And here you can notice again on this vocal cord there is one bump that is sticking out. So again that's causing a change in the voice.
As such.
Right. So abnormal voice production, நம்ம voice நம்ம குரல் வந்துட்டு கரெக்டா இல்லைன்னா எப்படி இருக்கும்ன்றது, this is what it might look like, right? Okay, we'll move on. இப்போ நெக்ஸ்ட் நம்ம வாய்ஸ்ல இந்த சேஞ்சஸ்லாம் வந்துச்சுன்னா நம்ம டெஃபினட்டா ஹெல்ப் எடுத்துக்கணும். ஸோ வாட் ஆர் தோஸ் சேஞ்சஸ்? நம்பர் ஒன் வந்துட்டு ஹோர்ஸ்னஸ் ஆர் பிரெத்தினஸ் ஆஃப் த வாய்ஸ். ஸோ வென் யூ ஆர் ஸ்பீக்கிங் ஒரு ஸ்ட்ரெயின் இருக்கிற மாதிரி, இப்படி இல்ல நிறைய காத்து வெள்ள வர மாதிரி, லைக் தேர் சோ மச் ஏர், சம்திங் லைக் திஸ். So more than sound, if you can hear more air or you can hear one scratchy sound, that's when we should be concerned. The next one is you are speaking and suddenly your voice is breaking. So you're saying and then suddenly it stops. Or if you're speaking, you're saying my name is Nayantara, but then nadula your voice is stopping altogether. The next one is limitations in pitch range. So if typically you need to raise your voice, you need to say you need to call out to the students in the class, and at the time you're not able to raise your voice and speak. So changes in the pitch, changes in the loudness of how much you can raise your voice. Louder பேசுறது தேவை classroom environmentல. So in that situation, if you're not able to speak louder, then another thing is in a classroom environment or in a school, there will be a lot of background noise. So in the situation, if you're struggling, like you're giving an instruction, but the students are not understanding, அவங்களுக்கு புரிய மாட்டேங்குது because உங்க வாய்ஸ் கிளியரா இல்லை. அதை தாண்டி, like by the end of the day or the end of one class, you're finding tiredness, fatigue. So you're not able to use your voice. You're like, no, I cannot speak more than this. There's lots of discomfort. The next one is breathlessness. So you're talking, நீங்க பேசிட்டே இருக்கீங்க, நடுவுல அப்படியே மூச்சு எடுத்து பேசுற மாதிரி இருக்கு. So you don't find that comfort with your breathing when you're speaking. The next one is chronic throat clearing. உங்களுக்கு நிறைய இந்த மாதிரி you find that you have to constantly clear your throat, or only if you clear and cough you're able to speak well. And if that's happening a lot, this is another red flag. And finally, if you have any difficulty breathing or swallowing, sometimes patients will come to us saying that, I feel like something is stuck in my throat. I'm not able to swallow. There's something there. There's something there. So அந்த மாதிரி அங்க ஏதோ இருக்கிற மாதிரி தோணிட்டே இருக்கு. முழுங்கினாலும் தண்ணி குடிச்சாலும் அப்படியே தோணுது. That's what we're looking out for. So mainly, like, what we're focusing on is vocal demand. So I think all of you that have joined, you all have high vocal demand, right? You have to use your voice every day for long hours during the day, and probably continuously with not many breaks. So your vocal demand is high. So in such cases, even if one of these small things, small red flags are noted and it is consistently noted, that's when we need to seek help immediately. So இந்த மாதிரி ஏதாச்சும் உங்க வாய்ஸ்ல சேஞ்சஸ் இருக்கு, 2 வீக்ஸ் ஆச்சு, இன்னுமே இருக்குன்னா கண்டிப்பா நீங்க ஸ்பெஷலிஸ்ட் பார்த்தே ஆகணும். Okay. So specifically for teachers, these are some triggers, right? So in the triggers la unga environment la பொதுவாவே இருக்கு. So these things will probably make it more harder for you, and probably put you at more risk for voice problems. The first one is you have to talk in a noisy environment. So you have to raise your voice. So that means on a normal day, you will be using your loud voice for a long time, right? The second thing is, and lack of adequate breaks. So yes, you have maybe little time between classes, but that's not enough, right? So that's another cause where we're not having a rest for our voice. The next one that we find a lot is hydration. Thanni, water intake will be really poor because again, no time, and that's not a priority. Like we need to get through the classes, we need to finish the the portions that have been assigned, and need to get through the day. So lots of competing responsibilities. The next one is dust exposure. So you're in an environment where, like, if it's a chalkboard type of school or college environment, then and the dust exposure from there. And in general, all of us these days, because of pollution, have a higher dust exposure. So that's something that will trigger a voice, maybe an allergy, and then after that, a possible voice issue. Then talking for a long time without a break. So if your classes are around like ஒரு 45 minutes class போகுது, அந்த full 45 minutes நீங்க பேசிட்டு இருக்கீங்க, பிரேக்கே எடுக்க மாட்டேங்கிறீங்க, that's another trigger. Then more about our lifestyle, right? So if you're not eating those 3 meals, breakfast, lunch, dinner, you're not able to have lunch time kadakka matingudhu. Mostly I skip lunch, or I eat my lunch very late, எனக்கு 4 o'clock அப்புறம் தான் டைமே கிடைக்குது சாப்பிட. So these are all behaviors that over time can have an impact. And finally, like a lot of increased stress. So yes, your job is quite a stressful, high intensity job. So அதோட சேர்ந்து, like if it's affecting your sleep, because sleep வந்துட்டு நம்மளுக்கு ஒரு recovery time. So voice-க்கான recovery time we need. So if you're not able to get that 6 to 7 to 8 hours sleep, then you're not having enough time to rest and recover. So as teachers, these are the possible triggers that you might have for a voice problem. And in specific, if we think about it, when we have teachers that come to us, like they've had a voice issue, and when they come and when we look inside their throat, right, on the kural naangal paakrappo, we tend to see something called vocal nodules. So in the picture la neenga paaka mudiyum, it's like 2 or boils madri, bumps madri and the vocal cords la. And this is something where, because of the presence of this, வாய்ஸ் வந்து பயங்கர ஹோர்ஸா இருக்கிறதுக்கு வாய்ப்பு இருக்கு, ரைட்? ஸோ இஃப் யூ சி ஹியர் இந்த பிக்சர்ல கீழே நல்லா ஓப்பனிங் இருக்கிறப்போ நார்மல் சவுண்ட் அப்படின்ட்டு சொல்லும்போது யூ கேன் ஹியர் யுவர் வாய்ஸ் ரியலி நைஸ்லி. Whereas here with the vocal nodules, it's not allowing the perfect vibration because of the bumps irukadnala. So then when somebody is saying it can sound like this, ரொம்ப strained, ரொம்ப ஒரு ஸ்ட்ரெஸ்ஸோட, ரொம்ப ஒரு ஸ்க்ராச்சினஸோட. Otherwise in English we call it hoarseness, right? You tend to hear that hoarse voice. So teachers especially are at risk for vocal nodules, and this is what we tend to see for teachers. So that's something that unga voice change aguduna, that's something that you need to get immediately checked so that we can prevent this vocal nodules quite early enough, right? Okay. So what's next when we do notice that these are symptoms that we're seeing in our voice? In the madri changes irukku, what do we do next? Early identification is very very important. இந்த மாதிரி வாய்ஸ் ப்ராப்ளம்ஸ் இருக்குன்னா ப்ளீஸ் டோன்ட் வெயிட். ஐயோ சரி ஆயிடும், இப்போ ஒரு 1 week தான் இருக்கு, இட்ஸ் ஓகே. 1 week is still okay, but like 2 weeks or more, you have all these complaints and it is affecting your work. Like உங்களால உங்க ஒர்க்கை effectively பண்ண முடியல, it's causing some changes, you're not able to take your classes effectively, then that would be something I would get immediately checked. And you need to have a professional evaluation done, right? So you need to see an ENT doctor first so that we can see inside your throat and the vocal cords எப்படி இருக்குன்னு பார்க்க முடியும். And other thandi, then depending on if there is a voice problem, you need to get it evaluated by the speech therapist or the speech pathologist. And then based on if you need further treatment or exercises, they will be the ones helping with that. So don't wait. Early identification means that we can give you early intervention, we can help you earlier, so that we can prevent those effects of how it affects your work. All right. So suppose you do come to a hospital or you do come for an assessment. I understand yarukume hospital vara pudikadu, doctor paaka pudikadu, it's not the most favorable thing. But I thought இன்னைக்கு I would just give you an idea. நீங்க ஒரு வாய்ஸ் evaluationக்கு வந்தீங்கன்னா என்ன மாதிரி இருக்கும், right? So the first one is we will take a history and a background. So எங்கெங்கெல்லாம் உங்க வாய்ஸை யூஸ் பண்றீங்க, இதுக்கு முன்னாடி like if you've had any other health related conditions, and we will give you different tasks and understand what your voice is looking like. Unga voice quality naanga paapom. So that will be the step 1. Step 2, we will look at all the vocal behaviors. So there are lots of things that we can do to keep our voice safe, and there are a lot of things that make our voice very unsafe, right? So இந்த மாதிரி நீங்க பண்ற behaviors notice பண்ணிட்டு அதுக்கேத்த மாதிரி we will find out what are the behaviors that are affecting your voice. அதுக்கப்புறம் மூணாவது photo and video time, right? So we will put a camera inside your throat. Nothing to be scared about. It will just be a simple camera. It will go inside and நீங்க and the voice லாம் பண்றேச்சே we will be seeing how it is moving, right? So we'll take some pictures to see how the vocal cords look, and then we'll take a video to see how it moves. So in the madri, as you can see in the photo, we'll be looking at what the movement is and we will tell you about it. நீங்களும் பார்க்க முடியும், right? So in the real time la போய் video எடுக்கிற மாதிரி இருக்கும். So this is what the assessment will look like, and depending on what we find, then we go to the next step. Okay. இப்போ குவிக்கா I thought we'll take a quick break, and இப்போ எனக்கு சில statements இருக்கு. So voice help பத்தி I have a bunch of statements. So this part of our session, I would love some interaction from all of you. Okay. So இந்த statementsலாம் நான் படிக்கிறேன், நீங்க எனக்கு சொல்ல வேண்டியது whether you think it is a myth or a fact, right? இது ஆக்சுவலா கரெக்டான விஷயமா இல்ல தப்பான விஷயமா, அவ்வளவுதான். Okay, so if you can all get on to the comment section, then we will get ready and start reading out all of this. You can tell me just myth or fact. Everyone ready? You can say ready in the comment section and then we will get started. Comments la enga irukku ellarku therinjirka? On the side you can just find where you've been posting your introductions. You can tell me. Okay, we'll get started. Okay, thank you Padma Priya, thanks for answering. Okay, whispering இப்படி கிசு கிசு பேசுற மாதிரி, சீக்ரெட் பேசுற மாதிரி right? Whispering is good for your voice when you have a sore throat. So தொண்டை கட்டி இருக்கிறப்போ இப்படி ஹாய் என் பேர் நாயதாரா இப்படி பேசுறது, is it good or not good? You can answer myth or fact. Not good. Yes, correct. Well done. So, தொண்டை கட்டியிருக்கிறப்போ it is best to speak in your normal voice only or take breaks and speak, right? Please don't whisper. Whispering is um, not a good way to use our voice. Yes, not good. Great. Well done. Thank you all for participating. I love the participation. Let's keep it going. Okay, second one. Clearing your throat is harmless and necessary. Ippadi. So doing that, கணக்கிறது, is it good or not good? I think you should have the hint, we just spoke about it. Okay, it's not good. Good, well done. So, அந்த மாதிரி பண்ண தோணுதுன்னா, we should just have a sip of water or swallow your saliva. But definitely, if you have this behavior, you need to stop it from today. After today's session, that should be something you stop immediately. Okay, next one. Gargling with salt water cures voice problems. So if you உப்பு தண்ணியில நல்லா நீங்க gargle பண்றீங்க, கொப்பளிக்கிறீங்க, you're able to for your voice. Is it good or not good? Yes, not good, because when we gargle with salt water, actually it helps only like if you've got some throat infection or what we call pharyngitis, and the madri irukka, then that it will help, but actually it does not support the voice. If you have a persistent voice issue, voice la problem irukku, koral la problem irundite irukna, enna gargle pannalum adu seriyagadhukku vaaipu romba kammi. Myth. Good, well done. Okay, next one. Drinking, really good participation. Keep it up, guys. Just a few more. Drinking hot tea with honey is the best remedy for a sore throat. Hot tea with honey. Is it a myth or a fact? It's good. Okay. Actually, rather than hot tea with honey, our recommendation would be to just keep water intake going throughout, right? So what supports the voice is just plain room temperature water, not too hot, not too cold, with honey, without honey, nothing. So even if you're just sipping water all throughout the day, that's a really good strategy to preserve your voice. So honey may be good if you've got a sore throat or that, but it does not actually help with your voice, right? Okay, good. Next one. Only singers and performers need to worry about vocal hygiene. So, the people who are singing or doing some performance, mimicry, dubbing, only they need to be worried about their voice. Correct. Myth. So all of us are using our voice day to day, including me. I need to speak to be a speech therapist, so I'm using my voice all the time. And you all as teachers need your voice to run your job, to do your job effectively. So everybody needs to take care of their voice. Everybody needs to do vocal exercises. So all of that is helpful. Yes, correct. Next one. Drinking alcohol and caffeinated beverages does not affect the voice. Myth. Correct. So both alcohol and caffeine and things like sodas, all of that really dries out the throat. So tonda fulla, it becomes very dry. So when it's dry, and imagine dry irukkrappo nama pesittu irukom and the vocal cords vandu teenju poi, it just causes more hoarseness, right? So if you have a big coffee drinking habit, then try to find a way to at least cut down your intake, because all of these alcohol, soda, smoking, coffee, all of these dry out the voice, and really அங்க இருக்கிற layers எல்லாமே it sort of breaks it down little by little. Okay, next one. We'll quickly go through the others. I'll just go through them just for the sake of time so that all of us are. Yes, good. Keep the participation going. Next one. Vocal rest means complete silence. And the mauna viradam mari. Is that a myth or a fact? It's good. Actually, we never recommend complete vocal rest. So this is a myth again, because it's not possible to completely keep quiet on a day-to-day basis. So what we recommend is take breaks and use your voice as little as possible. But when you need to, you can. But try and sort of cut down your day-to-day usage. So if a doctor is recommended vocal rest, it does not mean complete silence. It means take some breaks but still continue to use your voice, right? Unless after a surgery, sometimes it's recommended, but otherwise vocal rest never means complete silence. Okay, so vocal exercises are only for people with voice problems. This we spoke about. Next one. If you have a hoarse voice, it means you have damaged your vocal cords. Myth or fact? Myth, correct? I think people are saying myth. Yes, so it's one of the first symptoms. It does not mean you've completely damaged your voice, but if you notice that hoarseness, it is just a sign your body is telling you something is wrong, right? You need to get it checked. ஸோ அந்த மாதிரி உங்க குரல்ல ஒரு கரகரப்பு இருந்துட்டே இருக்குன்னா இம்மீடியட்டா வந்துருங்க. தட் வே we can see அந்த குரல் நாண்களுக்கு என்ன நடந்துட்டு இருக்கு, உள்ளுக்குள்ள ஸ்ட்ரக்சர்ஸ் எல்லாமே எப்படி இருக்குன்ட்டு. Good, myth, well done. Last one. Loud environments have no impact on vocal health. Myth or fact? Myth. Good, well done. So even without us knowing, in a loud environment, we tend to raise our voice. Like, I don't know if you've all gone for like a movie or a concert, there already it is very loud. So then we have to speak louder to be able to be heard. So then we are raising our voice, and if we are doing it consistently, then it's causing an impact on the voice. Okay, thank you so much everyone for participating. Well done. We'll move on now. So these are just some myths. If you all have other myths that you heard about voice, குரலை எப்படி யூஸ் பண்ணணும், எப்படி பாதுகாக்கணும், இந்த மாதிரிலாம் கேட்டிருக்கீங்கன்னா you can very well type it in the comments. We can go through them at the end. Okay. All right. Moving on. So now we've you come for the assessment, voice problem என்னன்னு ஐடென்டிஃபை பண்ணியாச்சு. ஸோ ட்ரீட்மெண்ட் என்ன மாதிரி இருக்கலாம், right? So it can be any of these four, or it can be sometimes a combination of these, right? The main thing is to remember that I know I've put surgery in the treatment list, but the main thing to remember that is the technology these days is like so advanced. Like we have a discipline within ENT called laryngology, where there are specialists only looking at the throat. Just தொண்டைக்கானவே ஒரு ஸ்பெஷல் டாக்டர் இருக்காங்க. ஸோ இப்போ எவ்வளோ அட்வான்ஸ்டாக இருக்குது that you don't even need to worry about all of these things. So if that is the choice that is recommended, there's so much research நிறைய பண்ணிட்டு இந்த மாதிரி நம்ம பண்ணணும், ப்ரோட்டோகால்ஸ் இருக்கு, நிறைய இருக்கு. So you don't need to be afraid. But anyway, so the first one is voice therapy, right? So sometimes and the enna issue paatha, the first step that is recommended is voice therapy and voice rest. So do exercises that helps your voice, and then in between take care of your voice, right? The next one is injections. So if the vocal cord needs an injection, and the vocal cord play injection port, either to help it move or to help with the structure of it, that could be another option. The third one is medication. So a lot of times medicines are recommended. So if you see the doctor, they may say to take these medicines, see how you feel. அந்த மெடிகேஷன் ஒர்க் ஆகிறதுக்கு டைம் கொடுத்து திருப்பி வந்து பாருங்க உங்களுக்கு சேஞ்சஸ் ஏதாச்சும் இருக்கா அப்படின்ட்டு. So the third treatment option could be medications. And finally, surgery, right? So again, surgery, these are very non-invasive small procedures. But again, there are few options available depending on எந்த அளவுக்கு problem இருக்கு and based on that what treatment is needed. So typically இந்த நாலு தான் இருக்கும். Along with that, it will be those behaviors that we recommended which will be good for you, right? Okay, so some of these tips are already spoken about, but just sort of going through them. These are நம்ம ஒரு do's and don'ts. இதெல்லாம் செய்யலாம், இதெல்லாம் செய்யக்கூடாது அப்படின்ற விஷயங்கள். So the first one, as you can see, whispering, நம்ம already பேசினது, and the secret சொல்ற மாதிரி voiceல we need to avoid. Second one is frequent shouting, frequent raising your voice. That will be the second. And then the third one is like clearing your throat. இல்ல cough நிறைய வருதுன்னா இதெல்லாம். So இதெல்லாம் பேச்சு சம்பந்தமான what all we need to avoid, right? The next one is more of what we take in, right? நம்மளோட diet, நம்மளோட consumption. So the first one, of course, is water. Water வந்து நம்ம vocal cords is like the best thing. So vocal cords நம்ம பாடிக்கு எப்படி தண்ணி தேவையோ vocal cordsக்கும் தேவை. The more you take your water intake, you're keeping அங்க இருக்கிற structures, you're keeping it really moist, really hydrated. So we recommend like 8 to 10 glasses or like 2 to 3 liters per day. And not ஒரு ஏரியா லைக் லஞ்சுக்கு அப்புறம் நான் நிறைய தண்ணி குடிப்பேன், பிரேக்ஃபாஸ்ட்க்கு அப்புறம் நான் குடிப்பேன், ஆனால் டே பூரா குடிக்கிறது இல்லை. So that's not what we mean by hydration. We mean consistent, like every 1 hour, every 2 hours you're taking intake. And especially when நீங்க வாய்ஸை யூஸ் பண்றீங்க உங்க கிளாஸ்க்கு நடுவுல or கிளாஸுக்கு அப்புறம் having a sip of water. Like you can see, I don't know if all of you can see, but I have my water bottle here. I have it on my desk and I keep using it. Every 1 hour I need to drink. Ilana, I can see the change in my voice that happens, right? So the first one is water intake. The next one is so staying away as much as possible from really spicy and really oily food. So why we are bringing this up is like the spicy and oily food, it has a higher tendency to cause like, stomach issues, gas, reflux in the madrilam. So when you have reflux, so and the நெஞ்செரிச்சல் மாதிரி சாப்பிட்டதுக்கு அப்புறம் ஒரு discomfort மாதிரி இங்க, that's when அந்த foodல இருக்கிற ஆசிட்லாம் திருப்பி மேல வருது. And நம்ம சப்போஸ் உடனே படுத்துட்டோம்னா அந்த ஆசிட் நேராவே தொண்டைக்கு வந்துரும். தொண்டைக்கு வந்துட்டு அந்த vocal cords மேல போய் it will just and the surface தேஞ்சு that can be another cause for your voice problem, right? So even the intake, the food intake that we take is so important. It's really good to have a nutritious diet, well-rounded diet, water intake, and of course staying away from spicy and oily foods, right? The third one here, the colas and coffee, we already spoke about. All these are very drying. உங்களுக்கு இந்த habit இருக்குன்னா I won't say immediately stop it. If you can, great. But if you can't, at least try and reduce the quantity as much as you can. So slowly you can move towards stopping it altogether. And that doesn't mean like you. So one of the things that our patients might ask us, "Na soda kudichittu thanni kudicha, will it neutralize? Will it help?" But all those things don't help. Our voice does not work in that way at all. The main thing is to find in the lifestyle changes la kandipa kashtama da irukum, but the more that you can start changing, that will be good. Okay, so some more lifestyle changes. Sleep, like munadi sonna madri, in that 8 hours we sleep at night, vocal cord is getting rest, right? So that much rest is needed. You have spoken and the full day நீங்க class எடுத்திருக்கீங்க, வீட்டுக்கு வந்து திருப்பி பேசணும். இப்போ நைட் நீங்க ஒரு 2 hours 3 hours தான் தூங்குறீங்கன்னா there's not enough rest. Again காலையில எழுந்து get ready, go back to college or school and then speak again, right? So no rest at all, no recovery for voice and more strain. So sleep, very very important. The next one is overall health maintain பண்ணிக்கிறதுக்கு good exercise, good diet. So daily little bit of physical activity. I think we say it for so many other health conditions, but it is as important for voice also. And then finally, if you have habit of alcohol and smoking, again, very good to stop those for overall health, but again, all these things affect the voice, right? So these are some more lifestyle changes. Then this is more with the posture of how we make the voice. குரல் எப்படி வெளில வரணுமோ அதுக்கு தேவையான things. So the first one நீங்க பார்க்க முடியும் is like the posture. So இப்படி குனிஞ்சு, if we are sort of slouching and sitting, if our posture is not good, then we don't have enough breath support. But if we're sitting up straight, நிமிர்ந்து உட்காருறது, தலைய நேரா வச்சுக்கிறது, then we can take a nice deep breath. And then when we start to speak, we're giving the best possible chance for our voice. So posture, very, very important. Like when I'm sure all of you are doing it, like in a class at Krecha, you're standing up straight, you're talking. But that's something that we need to maintain throughout when we are speaking, right? The next one, this man holding his jaw. It's not jaw pain, but more jaw tightness. So sometimes we see our patients coming to us, they will be clenching, இப்படி full-ஆ இப்படி neck tight பண்றது, clench பண்றது, இப்படி tight-ஆ வச்சுக்கிறது. So then what happens when you do that, you're really putting a strain again on the voice. All these muscles are very tight, and so when you're speaking with that tightness, and really does not help. So that's something, if you're not able to figure it out when you come to see us, then we'll be able to help you reduce that tension. So that's something to think about. And finally, this photo, it may look like yoga, but it is just breathing, right? So what we're focusing on is our breathing. Like sometimes what happens, நம்ம அந்த breath முடியிற வரைக்கும் நம்ம பேசிட்டே இருப்போம் இந்த மாதிரி. So not even taking a second to take அந்த மாதிரி ஒரு இன்னொரு breath. So when we put pressure on our system, அந்த breath மூச்சு முட்டுற வரைக்கும் அப்படியே பேசிட்டே இருக்கிறது, then that's something again that's going to cause some strain. So if when you're speaking you find that you're out of breath or you're short of breath, then that's something we need to think about and of course start to change. Okay, so these are some these were some vocal hygiene tips. These are all things, like I said, about diet, about lifestyle, about the way that we are speaking, all those things that we need to keep in mind. Now, beyond this, I thought I will also teach some exercises, right? So, more than exercises, we will call this as vocal warm-ups. And these are exercises that anyone can do. It is not specifically like for singers or someone. But you do see, like நீங்க வீடியோஸ்லாம் பார்த்திருக்கீங்கன்னா பேட்டியில, like when singers come and say this is my warm up routine, they will do some of these exercises, but essentially anyone can do it. When you sit down to do it, again that posture is very important, and if you can even do it once a day, it will be so effective. And this is something that even if you do too much, like typically I will recommend a dosage of like 10 repetitions. But நீங்க அதுக்கு மேல பண்ணாலும் ஒன்றும் ஆகாது, because these are very protective for the vocal cords, right? So if you do these exercises, it will be really good. So I thought that I would get you all to try it. I don't know if we have video and audio of everyone, but if all of you can just nicely sit up in your chair, sit nice and straight with your back straight, and then whenever you all are ready, we will start the exercises. Again, if you all can post on the comments ready, then I will start teaching you. Ready? Okay, great. Okay, so the first exercise, we're going to sit right up, and humming irukla nama paatu padumbodhu we will do something like that. So adeda we're going to say the sound but we're going to really pull it for however long we can. So first take a nice deep breath, and then we're going to say Now, when we say this, we're going to make sure it comes from our nose. So, konjam oru cold irukkrappa nama eppadi pesuvomo andha madri. So, like, okay, great. All of you are ready. Okay, we'll get started. I'll show you once. And then after that, you all can try. Okay, so deep breath. So hope you all can try now once. So just say and then just pull it for however long you can. Okay. So you can try that once more. So nice. So if you take a nice long breath, then you can pull it for very long. குட்டியா ஒரு breath மட்டும் எடுத்தீங்கன்னா இவ்வளவுதான் வரும். So நல்லா மூச்சை உள்ள இழுங்க and then you can pull it again. Ready? So do it again. Something like that. Are you all able to do? You can give me a yes or a thumbs up in the chat. So this is essentially the first exercise. In the exercise or the pair humming, we try and say the sound because it is a very smooth sound. And actually, நம்ம கரெக்டா பண்றோம் மூக்கால நிறைய சொல்றோம்னா we will feel the vibration here. So இங்க ஸ்ட்ரெஸ் பண்ணாம இங்க ஸ்ட்ரெஸ் பண்றதுனால we are really producing a nice smooth voice, a good sounding voice. Okay, nice, very good. Lots of thumbs ups. Super. So this is the first exercise. Essentially, I will say, you can practice this 10 times, 10 repetitions. Nadula, so like any other exercise, when you're doing all of this, your voice will get tired. So, have your water in between, stop, take a break, have a sip of water, and then continue. So we'll just try it one more time and then we'll go to the next one. Ready? Okay, so that's the humming. The next one, I'll just show you that. Yes. So the next one is it's called a trill. There's two ways to do this exercise. One naakala panna mudiyum using your tongue. The other one is with your lips. So udadala kuda panna mudiyum. So there's two ways. Edu vardo you can try. The whichever one is easier you can practice, right? So the first one with the tongue is like this. So you're going to do so we're just going to say the sound tr, right? And we're going to do it from down to up. So we're going to go from a low pitch to a high pitch, right? So it will sound like this. And then you stop. So you come back down. So keela in the mela, stop, deep breath, and then mela in thirupi keela. So naakala pannona it will look like this. If you're going to do it with your lips, udadala pannona it will look different. Okay. So this one is not my strong point, but I will try and show you. Ready? As you noticed, enake voice stuck agudhu, so I'm going to have a sip of water. So it's the same thing but with the lips, right? So again அந்த மாதிரி ஒரு vibratory movement பண்றச்சே it provides a really safe sound for the voice, right? So அப்படின்ட்டு கத்தாம really smooth and really safe sound for the voice. So going back to our childhood, exactly, that's right. Those sounds that நம்ம சும்மா அப்படின்னு பண்ணுவோம், இது கொஞ்சம் இப்படி பாட்டு மாதிரி இழுக்கணும். Come going from down to up and up to down. Okay, are you all ready? Can we do it together? So I will do the tongue trill because that is easy for me. And then I will show you what one whole exercise looks like, right? Ready? Okay, great. So first, deep breath. Stop. Deep breath. So like this. So even if you're not able to do really long, if you're able to get started and the voice கேக்குது கீழ இருந்து இந்த and the difference கேக்குதுன்னா then you're able to do like the first step is achieved, right? And the more like when you come to us as therapists, voice therapists, then we can analyze how you're doing better and teach you more. But as a start, this is a good way to get started, right? So again, இந்த ரெண்டு எக்ஸசைசஸுமே வார்ம் அப்ஸ் மட்டும்தான். அண்ட் இது பண்ணும்போது டயர்ட் கண்டிப்பா ஆகும், பிகாஸ் யூ ஆர் கிவிங் லைக் ட்ரைனிங் மாதிரி, லைக் ஜிம் போற மாதிரி ஃபார் யோர் வாய்ஸ். ஸோ நடுவில் பிரேக் எடுங்க, தண்ணி சிப் பண்ணுங்க, வெரி வெரி இம்பார்ட்டன்ட். And then find a time to practice which is comfortable, like because these are warm-ups, actually you can even do it before your class. Like 9 o'clock class na or 8:45 ku idu rendume pannittu adukapra neenga class poi you can start. Or if you have a time in the morning or the evening, you can set aside in the rendume 10 pandradhukku. It won't take too long, maybe maximum like 10 minutes, that's all, 10 to 15 minutes. So whenever and the chunk of time irukku, you can try and practice these. But again, so typically voice exercises or vocal exercises, these need to be monitored by someone. So today is just an introduction. So if you have voice problems, you need to practice, and in the practice பண்ணும்போது you're still finding difficulty, then you definitely need to come back and see us. And இது கரெக்டா பண்றீங்களா, and in the exercises there are many more steps also. So if you need to learn all those, again you need more professional training, right, and professional evaluation. So these are the exercises. I'm just going back to the slides. So past on 16th of April, past week, was World Voice Day. So we celebrated to get more awareness about voice issues and tell more people about what are the things to take care of the voice and what are the things that don't help the voice. And this year's theme was caring for our voices, right? So for me specifically, and I think for all of you, our voice is our livelihood. So engal kurale engal valvadaram, right? So we need it to survive, we need it to make money, we need it to go to work every day. So if you have any changes in your voice, you need to seek help as early as possible, so that all of us as professionals can help you and give you the right guidance, and so that you don't end up in those myths that we spoke about earlier. I think that's about it from my side. Thank you so much, all of you, for listening. If you have any questions or comments that you want to share, I'd be happy to listen and happy to answer. And yes, please do get in touch. Voice therapy and voice evaluation is a big part of what I do here at SIMS, in the Institute of Voice, Airway and Swallowing at SIMS. So you can either get in touch with me on my email or come and visit us in the hospital, get in touch for an appointment. All of that is possible. So if there are any questions, I can take it now. Thank you. You can just, I think, post it on the comments. Okay, so Chitra is saying, what are the good exercises during winter time? Actually, there are no changes to the exercises depending on the seasons. I think in the season change, we are more prone to cold, flu, infection. So that's more what we need to take care of. So when we are sick, it is very hard to use our voice effectively. Sali pudikumbodhu koral use pannano, pesano, class edukanona is very very difficult. So do all the things that you can do to prevent yourself from falling sick. Otherwise, in terms of exercises, there is no change. The same exercise only you have to do. But if you're sick, thonda katti irukana, on those days, I would urge you to try and use your voice less. If you can get a substitute teacher, or if you can get somebody else to help you on those days alone, that will be good. How long the warm-ups have to be done? So you do 10 of the humming and 10 of the trill. So you take like that would be 1, then you repeat that 2, 3, 4, 5, 6, 7 until 10. So maximum it will altogether to do 10 of this and 10 of that, it will take you like 10 minutes, not more. How long? I think if you want to preserve your voice, these warm-ups can be done all the time. Like there's no like end date for it. If when you're doing it, you're finding any trouble, then you need to come and see us. Okay. Why sound gets affected due to cold? What can we do to recover our sound during cold? We need to take enough breaks. So when you have a cold, take a break. It's um, like kai adipatta, we will use our kai little less, right? At that time, we will give it a break. We will use the other hand. So like that, தொண்டையில கட்டி இருக்குன்னா அந்த டைம்ல கொஞ்சம் கம்மியா யூஸ் பண்ணுங்க. Focus on getting your cold better. So whether that's taking medication or eating better, taking lots of fluids, all those things that your doctor recommends to get the cold better, you should do. And the timeler again same things, hydrate, keep your voice usage little restricted during those times. These two would be the best. Okay. How many of you were doing some of those behaviors that I said not to do, or any myths that you would like to share that you were believing about voice? If you feel comfortable, you can share it with us so that everybody else also might get to know. One more question from Ramya. What is the reason voice is dry and lips also? Ramya, you need to tell us what is your water intake. So I think some of you, if you are in AC environment, right? AC is terrible for the voice. The more time we spend in AC, our whole body gets dry, right? You will see your skin and all gets dry when you're in the AC for a long time. So the same for the voice as well. ஸோ ஏசியில் நிறைய நேரம் இருக்கீங்களா, கண்டிப்பாக நீங்கள் தண்ணி குடிச்சிட்டே இருக்கணும். தட் ஷுட் பி அ ப்ராக்டிஸ். யூ நீட் டு ஹாவ் யுவர் பாட்டில் வித் யூ ஆல் த டைம் and need to keep sipping. I'm not saying drink the whole water. Sips of water is very important, and especially if you are in an air conditioned environment, you need it more. All right. Thanks all of you for your feedback. Any other last questions or comments? Anyway, even if you don't have any questions right now, you can always get in touch with us or get in touch with me, and come and see us if you have a voice problem or something that you are concerned. Don't wait. Come to our hospital and you'll be able to meet us and get it checked. அதிக சத்தமாக பேசினால் குரல் நாண்கள் பாதிக்கப்படுமா? எஸ், நீங்க நிறைய சத்தமாவே பேசிட்டு இருக்கீங்க. லைக் சில டைம்ஸ் வந்து குரலை வசதி பேசுறது பரவாயில்ல, நம்மளுக்கு தேவைதான். we need to raise our voice. ஆனா அதுவா ஒரு பொதுவா ஆயிடுச்சு, அது ஒரு ஹேபிட் மாதிரி, ஒரு பழக்கம் மாதிரி ஆயிடுச்சுன்னா கண்டிப்பா இட் வில் அஃபெக்ட் யுவர் வாய்ஸ். இம்மீடியட்டா தெரியலனா கூட லாங் ரன்ல கண்டிப்பா தெரியும். Having honey in the morning is good for the voice. Yes. Unfortunately, that is a myth. It may help your throat, but it has no connection to voice. Okay, thank you for sharing the myths that you had. Can these exercises be done by people who stutter? No, this will not be helpful for stuttering at all. If someone has a stutter, the way that we manage that as a speech therapist is completely different. So these are only for the voice. Good question though. Right. All right. Okay. Thank you so much, everyone. Dr. Shivashankari? Was there anything else? Thanks for the feedback, guys. Drinking hot water always, is it good? Um, if it is helping you, you can continue, but I don't think it will have any effect on the voice. So that's something that people do either for their stomach or for their throat, but it's not something that you need to do it to help your voice. There is no recommendation like that. Like I said, normal temperature water throughout the day, 2 liter to 3 liter intake for one day. That's what we're looking for. So it doesn't need to be hot or cold, normal. Thanks, everyone. Thanks for your feedback. All right. Thanks, everyone. Bye bye. Close for now. Okay, that's it.